1 second, one more second. All right. Well, thank you so much for inviting me today. I'm really delighted to be speaking to you on behalf of the Fred Hollows Foundation. As Gloria has mentioned, the Global Fred Hollows Foundation is based in Australia, and I work for a branch, the Fred Hollows Foundation New Zealand, that works in the Pacific. And today, as she mentioned, I'm joining you from the beautiful island of Fiji, and it is a small island nation, less than 1 million people in the country. And though we are part of the blue continent, though we may be separated by vast oceans, we share the commitment to the community. And it's honestly a real honor to be speaking with you here as we exchange ideas and experiences. I apologize, I know 5 languages and Spanish is not one of them, so you can ask me questions in Hindi if you want. So yes, the Fred Hollows Foundation is a vision. We work towards a vision where there is no one needlessly blind or visually impaired, and we do try to work with partners to end avoidable blindness in the Pacific, and so that everyone has access to high quality and affordable eye care. And you may ask, I'm not who Fred Hollows is. Fred Hollows is, he was an internationally acclaimed eye surgeon and social activist who championed for the right of all people to have access to high quality and affordable eye care. He wanted to empower the local healthcare professionals to deliver eye care services in their own countries. So Fred knew that the only way to help was to create a sustainable model, and that was done through training local doctors and to carry out the sight-saving work of eye diseases such as cataract and trachoma. Fred also went further and he opened factories in both Nepal and Eritrea, and this was for lens, for cataract surgeries, and he knew this would significantly cut down the cost of restoring sight. Sadly, he died in 1993 due to cancer, but before he passed on, he established this foundation so that his work would continue after he had left. When he found out that he had cancer, he didn't go into the hospital. He actually checked himself out of the hospital, and he said that he will continue providing services. So that's why he's so well valued here by the Pacific. Like Fred, we are not holding back until we end avoidable blindness in the Pacific. We do have challenges in poverty and eye health, but with the assistance that Fred Hollows Foundation provides us, we have been able to make somewhat of an impact. Currently, we focus on majority of our works in 14 countries throughout the Pacific, and as you can see, I'll point it out, this area here, we're just separated by water, and we're small island countries, and it's really difficult for people to access services. So the small population size and large geographical distances between the islands in some of the countries create a major challenge for the scale of health, especially ophthalmology. So the work that we do is separated in 4 pillars. One is to restore and preserve sight, and one is to train and support the regional eye care workforce and strengthen the local health systems, and also to do research and drive innovation. These are all embedded into the SDGs, and out of the 17 goals in the SDGs, we work towards contributing to 12 of them. So the 3 major causes, according to the research that we have done, the 3 major causes of blindness that we face in the Pacific is cataract and diabetes, eye diseases, and refractive error. Diabetes is one of the major issues that we're now seeing. There is a tsunami of NCDs in the Pacific, and if you have seen NCDs in the Pacific is one of we're actually one of the highest number of people that has. So every 3 people, there'll be 1 person with diabetes in the Pacific. That's what we've seen. So the burden of diabetes is high, but cataract is still the leading cause of blindness in the Pacific. Sorry.
Why?
Sorry?
Why?
Well, because the change in lifestyle. in the Pacific, introduction of Western food, and previously the population used to be farmers, and land issues. I can't specifically say. I need to back it up with research, but there's a whole lot of factors affecting that, and yeah, there's a tsunami of NCDs in the Pacific. So how are we handling that? Like I said, Fred Hollows Foundation Australia, as you mentioned, we work with the Fred Hollows Foundation New Zealand, which was established in 1993, and they opened up a office, Vision 2020, in the Pacific in 2002. Through this, we did a situation analysis to see what the status of eye health was in the Pacific at that point, and we saw that not many we didn't have many HR. They weren't trained doctors or nurses, and we relied quite heavily on visiting teams to come in. Therefore, there was no continuity of care. There was no skills transfer, and people within the Pacific were reliant on the visiting teams. But we also saw that they were being used as guinea pigs. Therefore, the Fred Hollows Foundation established the Pacific Eye Institute in 2006. It was based in Solomon Islands, and if you know about the Pacific, we are always having political issues. So due to political upheaval, we had to move to Fiji in 2007, and when we moved here, we had a coup in the country. So, but we still pulled through, and it's been 20 years since we've been working in the Pacific, and we are located in Suva, Fiji, and we work closely with the Ministry of Health Hospital and the University of Fiji, Fiji National University. In addition to this, we work with 14 Pacific nations, their ministries of health, so that they send their doctors and nurses to be trained at our regional institute. So how do we do this? We have two programs. One is for the nurses. The nurses, so far, for the past 20 years, we have been able to train 191 eye care nurses and eye care personnel in the 14 countries. And this is done through a postgraduate diploma in eye care. It is a 1-year program. And we don't just train them. We also continue to provide them with continuous professional development and mentor them when they go back to their stations, because usually they don't have a trained ophthalmologist or eye care personnel to go under supervision for. For the doctors program, we've so far trained 36 eye doctors in 10 countries. And this is done through our postgraduate program for 1 year in diploma. And then that is continued into a master's program for the additional 3 years. Like I said, diabetes is one of the major cause of blindness in Fiji, and we don't have that specialist area in Fiji itself, so we have to do referrals to overseas for this management, and it costs us about 10,000 Australian dollars just for the treatment itself. So now what we're doing is we're going into subspecialty training. We're trying to find subspecialty doctors to come into the country and train our doctors in these areas. So far we have been venturing into VR and glaucoma as the two major fellowship that we have been able to get off the ground, but we're still working on that. We do partner with the RANSCO, which is the Royal Australian New Zealand College of Ophthalmology, Irvine Institute of Eye in India, and IAPB, and obviously APAO and Cyforal from Australia. We also have had a few Mexican doctors who come in and have worked with us to help us train these doctors. But overall, you can see that we have trained around 227 eye care personnel, and this is where they're located, out there in this area. Our model that we use is that we're training, it's an integrated model. So we have training, service, and systems that we work towards strengthening. So we combine the clinical services delivery with academic training, and the students get to learn in a real world clinical environment. And like I've mentioned before, it is a wraparound method. We don't just train them and send them back. We ensure that they have the infrastructure, they have the equipments, the consumables to continue working till the Ministry of Health is able to integrate that system into their ordering system. They've provided with infrastructure. So at the end of their training, when they go back to their homes, we go and visit them within the first year and see where the issues are that they're facing. If they don't have equipment, we provide them with that. And they don't have consumables, we try to get the ministry to integrate that into their supply chain. So we try to encourage the ministries of health to have their national eye care plans. So this is most of strengthening the whole health system through local ownership and integration. As part of our program, this is some of the places that we tap into. We have a diabetes eye clinic. It's separate from the main eye clinic. And because of the influx of diabetic patients, we've now decentralized it. We are also reaching out to the communities. We're going into the communities and providing the services at their doorsteps because we've seen accessibility is an issue. There's always, with diabetes, there's some sort of disability. And as Dr. Manuel was mentioning, it just doesn't affect the person itself, but also the family as a whole. So there is someone who's always, has to come with them to the main clinic, and they were not able to do so. So we are reaching out to them through our outreach programs. We have also a general outpatient department where comprehensive eye care services are provided. We also have a mobile eye clinic. I'll talk to that later on. But in addition to this, we have a refraction clinic, and we go out in the communities and do screening. And if those communities have a long backlog of patients needing surgeries, we send our surgical teams out there. So in total, I know this number might not look big for you, but for us, it's quite big because of the small population we have. We've been able to reach out to 486,000 people through this program. We're not just based, like I said, in the hospital itself. We have to go out in the communities also. And these communities, like I said, is through our diabetes retinopathy outreaches. We have our mobile eye clinic outreaches and the screening outreaches. We also go out to the other regions also, not just within Fiji. So some of the challenges that we definitely see is that, the islands are remote. Within Fiji, we have 300 islands. Approximately, I think 164 is inhabited. So even then, it is a lot of islands that you need to go and provide services to. And there's always shortage of specialists. Now, when we go, we do cataract surgeries. The outcomes is not as good as before because they have diabetes retinopathy, some level of damage behind the eyes already. So awareness is something that needs to go in because there's a huge reliance on traditional medicine, or they don't want to come to the main hospital. So we need to create that awareness for them to keep coming back to us and continue the care. Denial, most of them deny. They have diabetes. They always say, "Oh, I had diabetes. I'm taking herbal medicine. It's good now." So there's some of the things that we are facing, and also the health system itself, in terms of data and the system, the patient information system is not really good. So we rely heavily on manual documentation. The hospitals keep files which we have to go through. So these are some of the challenges that we're facing. In the Pacific, poverty and blindness are deeply interconnected. So many of our island communities face limited access to basic health. And I just want to keep echoing what Dr. Manuel said, is that the ministries of health themselves don't provide much budget towards ophthalmology. A lot of them go to other disciplines, and this just creates a lot of burden on non-government organizations like us. But we are trying to shift that slowly. I must say that, addressing eye health in the Pacific is not just a medical issue. It is a social and economic issue. And but when we restore the site, we restore the opportunity, and we restore. And you might, as ophthalmologists, see that you restore dignity to some of these patients.
Yes.
This here, when we opened our Pacific Eye Institute, we saw that we were only seeing the patients in the central division, and the people who were coming in were at the end stage of their diseases. So we found out that many of the people were not coming to us. Therefore, we wanted to reach out to them. When we started screening, we tried to utilize the local divisional hospitals to provide surgeries. Unfortunately, the operation theaters were not in a condition where we could use that to provide services. And when there were operation theaters, we were not allowed to use it, or we were just given a few hours in a week to do the operations. Hence, we came up with our mobile eye clinic. This is a 11.5-meter facility, and it has a a consultation room and an operation theater and a sterilizing room. It just needs to go and park at a divisional hospital and connect to water system, and it's partially powered by solar and a generator. But eventually, at the end of the year, we're trying to put it fully by solar, so that it just goes and parks in a division, and we're able to provide services. So it goes and parks at a hospital. Then we send our team out into the villages and screen the patients and feed them back into the mobile eye clinic where they're operated. So reaching out into the communities, we've been able to do about 73,000 people we've reached out in the periphery. So while these student doctors come in and train, they're island countries. They don't have anyone there. So what we do is we also send our team out to their countries to provide services at least once or twice in a year while they are training. The good news is that now we have been able to train a lot of doctors and nurses, and each of these countries now has at least one doctor and one nurse in their islands, but not for the smaller island countries. But we still go back to them because definitely they're general ophthalmologists. They need specialty care. So they collect all those patients, and then we visit them when their need is there. So yes, the Pacific Eye Institute is living the example of Fred Hollow's vision in action, and we want to utilize the Pacific people to restore the site to Pacific communities, which is, you're serving your own people. And this model is ready to scale, and it's sustainable, it's proven, and it's owned by the people in country. I just want to highlight that, the Fred Hollows Foundation Australia commissioned a study called Investing in Vision. The study was conducted by PricewaterhouseCoopers, an internationally consultancy firm with the expertise in health economics and policy. The landmark study showed that $4 of economic gain can be made from every dollar spent on eye health in developing countries. I think there's another study that was done just recently. I think IPB might highlight that also, but yeah, the investment in eye it's provided compelling evidence of greater investment in the healthcare system. And these are some of the pictures of the people that we have provided services to, and the smiling faces of our patients whose sight have been restored through the work of the foundation. Once again, I just want to thank you all for inviting me. If you have any questions, to let me know.
Well, thank you very, very much, Kirti. Wonderful description of the scenarios that we are challenged with in poverty-stricken countries like our own in a different way. Though just seeing how far off they're like stars in the blue sky, they're all over the place. But to face perhaps and to explore different strategies that might be worthwhile in different countries, we have our next speaker. Thank you very much, Kirti, again. Good luck with your your project. You just eliminated trachoma in Fiji, so congratulations.
Thank you so much.
Well, now we have one of the strategies which might work when we have such distances between the health services is the mobile outreach programs. And for this, we are honored to have the Carlos Slim Foundation. We'll have Gloria Luz Saldaña Uranga, who's the head of communications in the foundation. She's been so for the past 18 years. She is an expert in communications and has worked in public health and in the health ministry for many years, and advocating for NGOs and different social programs. So thank you very much, Gloria, for being present.